Good morning, everybody. Welcome to the Statutory Advisory Board meeting. It's being held via Zoom under a law signed by Governor Baker, and it's been extended by Governor Healy through March 31st, 2025. As you just heard, these meetings are being recorded. It allows local recordings and makes these available for the general public. Welcome, everybody listening. Welcome to the board members and MCB staff. I do want to make one notice that beginning the next meeting on November 7th, this meeting will start occurring at 12 p.m. from 12 to 1. And we'll keep it there as on a regular basis, unless for some unusual thing that we don't have a quorum for our committee board members, we'd have to shift it. But assume for right now, at least, that we'd make every effort to have beginning November 7th on, these meetings will occur every first Tuesday at noon for everyone's reference. Okay. I'd like now back to the board members. Any discussion or questions about the minutes from September 5th?
No edits or changes.
I'll make a motion to approve.
I'll second that.
All in favor? Aye. Aye.
Aye.
Okay, unanimous. Thank you very much. Appreciate that. Commissioner, updates for you, please.
Hello, good morning, everyone.
Okay.
So I'm sure everyone probably has heard, or most of the people have heard on this call, that Secretary Walsh announced that I was being appointed the commissioner. So I guess we could remove the acting away. I've acted long enough, I guess. So,
Congratulations.
Congratulations.
And thumbs up.
And so we're looking to move forward and just continue to do what we do here and work on serving our consumers. So touch base on the reallotment project that we did receive. So we have a meeting scheduled later this month to discuss the dashboard, and the consumer groups were invited and the SAB has been invited. Brian, I think you're the one that got the invitation, but you can invite anybody on the board that you would like, or anybody can come that would like to sit in on that meeting. We're also inviting the State Rehab Council so they can chime in on what they're may be interested in seeing as far as statistics go. So hopefully at the end of the project, so this will be like the meeting that will sort of go through and sort of nail down the specifics. And then that'll give us the information that we can add to the request for response that we will put out shortly after. And then so that the companies bidding on it will have an idea of what type of data we're looking to capture. And when they start developing the project, then they'll know that and have that in mind. So they'll work with agency staff here regarding the data. Anybody on the SAB board, if you'd like to sit in on something in any of the meetings, we'll certainly invite you, and anybody on the consumer groups, and so that we can keep it going along. The main thing is that once we put the RFR out, and once they have a couple of meetings, they pretty much it's moving forward. You start incurring additional charges if you start changing your mind. So it's very important that we all agree and on the statistics that you guys all want to see. I'm okay with anything you would like. So it's going to be getting the consumer groups, the boards here at the agent, the councils to agree on what data. You may come up with 20 pieces of data, and we may only be able to provide 10 because others we just don't collect. Mm-hmm. So the easiest ones to collect that we can release is the ones that we collect for RSA. That's part of our 9/11. There may be others that are collected as far as registrations and those sort of things through other means. If it's something we can get fairly easy, we will do that. But to create, if we're not collecting something and to create it, that means that we will have to spend additional money to alter the case management system, because I'm assuming the dashboard will not be able to retrieve it if it's not being made available through the case management system or through another system that may be used. So looking forward to moving forward with that, and we'll definitely bring the information to the meeting here so that those who are joining us can also be aware of the process that's going on.
So John,
So
this is Brian. So this is October 17th, if I remember correctly.
That's the one.
For Kathy and Blair, for your reference, if you're interested, I think it was 11:30 in the morning, if I remember correctly.
Yeah, it's 11:30.
All right, thank you.
If there's a meeting invite that, can you forward that along? I don't think I've seen that.
Yeah, Brian, you can forward the meeting invite that you got from Lucy. Or
Thank
actually, Lucy, maybe Lucy can send it to Kathy and Blair.
Yep, I can do that right now.
Save the trouble.
Thanks, Lucy.
All right.
You.
All right. The reverse job fair is happening. That's the job fair that we have our consumers present to employers. We had the first session last week. We had the education session for employers in late September. So therefore, this Friday is part 2 of that reverse job fair with a second group of candidates. So this appears to be receiving always a lot of good feedback from the employers. So we hope that we get a lot of interviews out of it, and some folks do obtain employment from that. The media campaign that probably most of you have seen across in some way, shape, or form now, either on television stations in the Boston area or in Massachusetts, actually, and the different digital media that you may have been exposed to. And this month, we're supporting the White Cane Initiative. So 200 billboards throughout the state are releasing information about the White Cane in celebration of White Cane Month and White Cane Awareness Day. So that's gone very well. We'll see how it goes. These results, sometimes you have to wait a bit to see if people are responding or companies are responding. But hopefully we've planted enough of a seed in someone's mind that down the road, if they haven't done it yet, they will reach out to MCB and will be interested in having us put them in touch with the job candidates that are ready to go to work. So we'll see how that goes on. The White Cane event, as I mentioned, is happening. Many of you have received through our digital channels announcements on it. It's at the State House. This is we're back in person, so those of you who can come and are able to come and join us, that would be great. We want to trying to return a lot of the meetings back in person here at the agency. A lot of the state agencies are returning back in person with a lot of the different meetings, but and many are in person, but they're offering virtual options also. So just because something happens in person doesn't mean it can't happen both ways, so that both folks that cannot make it in can participate from home, and others who are able to attend in person can also participate. So that's happening. And I think last I was told that I think well over 100 people have registered so far. So we like to thank Perkins School for the Blind. They're going to be supplying the goodies for those of you who come to enjoy. So be sure to come, and we have our staff available and ready at the State House, and we're looking forward to returning this event back to in person as it was before the pandemic. I did check on the additional board members for SAB. Those 5 resumes of interest were submitted, and I was told that it's working through the process, and I think it's getting closer. But every time when we're trying to fill boards, any organization, any agency does take a bit of time to get through all the process, and we'll just continue to work and remind them, and hopefully next month we'll have some news and can move forward from there. So currently, the Executive Office of Health and Human Services is embarking on a strategic mapping initiative. The strategic mapping is similar to developing strategic plans, but it is quite an ambitious effort. They expect to do it all in 4 months. And so by late November, early December, we should have something done. We've had several meetings so far, and there are more planned in the next few weeks. And we'll continue to develop that. So I've been involved in strategic plans before, but never one with this type of scope. So I think all of us are working hard. All of the agencies are working hard to see this process through, and we look forward to seeing that at the end of it all. I believe there'll be a strategic plan for each of the agencies. And many of us, obviously, if we're under the Executive Office of Health and Human Services, have many of the same missions, and we touch, in some cases, we touch a lot of the same consumers. Many of our consumers are being served by 2 or 3 agencies, and it seems like a good idea, or a workable idea, that those agencies that are serving you are all following similar strategic plans in the hopes of offering you the best opportunity, the best services that we can offer. So we will continue to work on that, and we'll do what we can. So why don't I let Nate come in now and give you some of the statistical data, and then I'll follow up with anything else I have, and then we can move on after that. Nate, you ready?
Yep, I'm ready. Thanks, John. I'm going to share my screen.
Morning, Nate.
Good morning. All right, so on the screen, we have the MCB dashboard summary, which was completed yesterday, 10/2. Currently, for registrations for the year, we are at 1,328, as opposed to 2,174 last year. Again, it was a little bit higher last year with folks coming out of COVID. We are going to be releasing a communication to providers across the state in the next couple of weeks, just letting them know the best way to register folks through our portal, if they need assistance in any way in training their front-end staff or themselves in entering people into the portal, and just a synopsis of the best way to connect with people from the registration team. So that should be going out in a couple of weeks to providers. So we'll see if that gives us a little bit of an uptick uptick in the registrations or not. A lot of people are using the portal now. We're getting very few faxes in. I would say close to 90% of our registrations are coming through that online portal at this point. As far as registering, yes.
Nate, this is Kathy. What do you hope for registrations? I'll assume that the 2020 and 2021 numbers maybe were a little lower than usual, 2022 a little higher. Where are you kind of hoping to land?
Yeah, I mean, I think we're right about where we expected, to be honest with you. Not as high as last year and higher than the COVID years.
Yeah.
So we currently are in that range now. But we just want to make sure we're doing everything we can on the registration side of the fence to make sure that people have the best access to register folks with us and the knowledge to do so and to do it the easiest way for them. And, you know, there's not really an expectation of trying to get more people because it's a law that they're registered with us. We just want to make sure we're accessible for those providers to make sure that they can get that information to us and we can get out and serve those folks. So it's a rate about where I would expect it right now. And we'll see if that communication provides a little bit of bump. Sometimes people are holding them or there is an expectation that these folks are registered with us in a certain time period, but we understand with staffing changes and those stuff on the provider side of the fence, sometimes they get a little bit delayed. And sometimes, we'll get connected to a consumer that says, "Oh, I was told by my provider that I'm legally blind. How do I get services?" And that might sometimes spark a connection with that provider to say, "Hey, we heard from this person. We just want the eye report and stuff," and it kind of helps there. So,
Great.
yeah, I think we're right about where we should be.
Okay. Thanks.
We had quite a few come in over the weekend, so you can see as I ran the numbers Monday, they're usually pretty low, but a little bit higher than normal with the 13 in quality control. So those are ones that are waiting to be reviewed by our registrar to make sure that they are indeed legally blind. We had about, I think at the beginning of Monday, 30 something. So this was the updated numbers this morning. The oldest case, I had to taken this out because it was always the same day, but the oldest case is yesterday at this point. We did get 6 faxes come in, which is kind of unusually high. So good timing for that communication that's going to be going out. And the needs verification, we're down to 1 that needs additional verification to be registered or not registered. Not a lot of changes in our open cases. Pretty steady throughout, 839 children cases, 2,065 SR adults, and 1,009 DBES consumers. That's an tick of 2 for the children, 41 for SR adults, and 7 for DBES. So pretty steady there, and even more steady on the VR side of the fence, where we're at 725 VR adults, 200 pre-ETs, and 15 transition youth. And you see we went down 1 in the VR adults, 1 down in transition youth, and up 1 in the pre-ETs. So very little change in VR. Closed cases, we're currently at 86 closed children cases for the year, calendar year, and close to 1,700 for the SR adults closed cases this year. So right on trend with the previous year. And closed VR cases, again, this is fiscal year, so this is calculated a little bit differently. We're at 30 successful closures and 26 non-successful closures. And that, looking back at the numbers last year, we're pretty much trending at the same rate as we were last year at this time.
Nate, is that October through September, the federal fiscal year? Or is
This
that
is
June?
we go through the calendar or for the state calendar fiscal year, so that is from July 1st through October 2nd.
Okay.
It does say
July
payable
1st
though,
through
just so you know.
October 2nd? Oh, July through June is what you consider the federal fiscal year.
The state fiscal year is July through June. The federal fiscal year is October 1st through September 30th.
So when the closed VR cases says federal fiscal year? what
Yeah,
are you
that should say state.
Okay, that's what I thought. Okay,
I'll adjust that.
okay. Gets confusing sometimes between calendar
Yeah.
years, state fiscal
Yeah.
years, federal
I
fiscal.
meant, yeah, right, exactly. And it actually, I just wanted to say fiscal year, but we do calculate during the state fiscal year. Support services, currently at close to 2,700 people. These are people that are referred to either rehabilitation teaching, assistive technology, or orientation and mobility within MCB. And then auxiliary services, these are the central registration services. So these are certificates of blindness where we're at we're at 6,200. We've done 824 IDs this year as an agency, 357 EDPs. Those are the phones, and then the 52 handicap placards at this point. And that's where we're at. So not a lot of big changes or any surprises. Again this month, which is good. Does anybody have any questions?
Not
No
on that,
additional-
I don't know. We did, I know we've had a couple inquiries about big data, like, is there any kind of update you have on that as well, Nate or John, either one of you? The big data
John, do you want
project.
to talk about the dashboard?
Is it just the dashboard part of it, or was it anything
No.
else?
What else was that? I don't.
I don't think there was anything else, and I'm just making sure I'm not missing anything.
No, you're not.
Okay, so we'll know more once we meet and get going on all that for specifics.
Yeah.
Great.
Okay.
Thank you.
Thanks, Nate.
Thank you.
Just a quick reminder that October is National Disability Employment Awareness Month, and there'll be lots of activities going on, different organizations. I know that Work Without Limits is having something on Thursday at the State House, so if you guys haven't had a chance to sign up, find out about it. We're going to have some staff there. Many of the organizations are releasing information and statistics and events, so watch your email closely, and we'll circulate what we can through our digital channels, and we'll keep celebrating October as a great month. So I don't have anything else, Brian, so we can go on to the next step if you like.
Yeah, so at this point, I put a bullet in here. If we, the SAB members, had any specific questions, it gives us an opportunity to follow up, or if anybody had reached out to them individually we normally would review that ahead of time and then bring it up. But we didn't have any this month either. If Kathy or Blair have any other questions right now, we have a couple minutes before we open it up to the public, just for reference.
I do have one interest area that I think just raised, I don't know if on this call or via email, just around the survey results. You had done a big survey, John. I forget the
Yes.
name of the organization who
Yep.
did it, and the results were to be available over the summer. So I'm just wondering if that's something we can get access to,
Right.
or
Yeah, so we have the survey. It's completed. Last I knew, Nate, you had a form. We were submitting it to EOHS, to the communications folks, to have it vetted before
Yeah.
we release it. Go ahead.
There was a vetted form. It was sent in a couple of weeks ago. We're just waiting to hear back to get the clear to share that information. It is complete. We are looking forward to sharing it. It's very positive. So we're excited to share a lot of the results from it. It's again, without going into it too much, a lot of it was around service satisfaction, and like I said, it was a very positive result for us.
Yeah, the ratings are pretty good. We're good, but when there was quite Nate and I were surprised at how extensive the form we had to complete. Pretty lengthy form, and but we got it in, and so they'll review it, and then they'll get back to us and we will send it around and distribute it to whoever wants to take a look at it. I'll mention,
Great.
I'll mention something briefly that you know it breaks down. It shows that we're doing pretty well in most of our consumers, but one of the areas that talked about underserved populations. So we do have some numbers on that, and the governor just signed a language access order that is going to have agencies boosting up their access to different multiple languages at the agency level and at materials. We have interpreters that we use on a regular basis. So again, we'll probably be doing outreach to different ethnic communities, just to again continue to spread the word on that. But there's some data in that survey that may help us also. But overall, it's a good positive survey, and we'll definitely look over it closely again and take some more information out of it and use it the best we can. And since it'll be a resource for us.
Be looking
Thank you.
forward to seeing it. That's great.
Mm-hmm.
Brian, I have a few questions for John, if that's okay.
Sure.
John, would you be able to provide us next month or the month after that with a summary report of the results of the reverse job fair? I'd like to know, if possible, how many potential candidates were interviewed and how many actually were employed, and how well the employers thought the candidates were matched up with the job skills that they were looking for. And I'd also like to know, how do we get employers involved in this program? Sounds like a wonderful program. And just want to make sure that employers are thinking what big picture, wide picture, and then I'd be interested to know the kinds of jobs that they're looking for. We as visually impaired candidates to be able to be talented enough to fulfill.
Okay. I'll have our employment services team come in and give you guys some data on that. But I sat in on the first session last Friday. I think we had somewhere close to 42 employers listening to the candidates. I think there were 16 different candidates. They had a 1 to 2 minute pitch that they were making. All the resumes were provided to the employers in advance of the candidates being there, so that they had some time to look at over while listening to their pitch, and we'll be able to use that data to decide if they wanted to move forward with any interviews. The companies that we bring in are the organizations that Employment Services is always working with. They're always looking for new employers. So many of them are internship partners that have hosted interns over the years. Some years they do have a spot for an intern, other years they don't. Other companies were companies that have hired individuals, and we'll have to check with them to see if any new companies. And I think some of the companies were companies that came to the employee education seminar and then decided to join. But I'll have them pull together some numbers. I'm sure the committee will be getting together to sort of debrief and that sort of thing. So we'll definitely have them in to give you guys a report on the job.
Is this an annual event?
Oh yeah, Yeah, we've been
Right.
doing the job fair for years, except we
Yeah.
used to do the traditional one, where employers would have tables and our
Right.
consumers would go around table to table, bring the resume, and then it's been getting tweaked every year. This is the one we used to hold over at Harvard for many years.
Yeah.
And then with the pandemic, so we wouldn't lose steam, we converted it to online, and then um, after doing it once online the old-fashioned way, where employers had different rooms set up, I believe, and then this way we decided to do a reverse job fair, because it would allow the um, companies to listen to a variety of individuals. So why we broke it up into two sections is because we don't want to consume a lot of the employer's time. So they know that they've dedicated 1 hour to listening to these consumers, so that last week they had 1 hour, and then this Friday they will have another hour, and a lot of the same companies, and will be there listening again, and it'll be a new batch of consumers. So we think that this works well, geographically and transportation wise and mobility wise. We have candidates from all around the state because they're able to participate via Zoom, and the issue of getting around and finding a table is resolved because all the companies are listening to you, and you're not don't have to be moving around. You can focus on your pitch. We do have a practice session, some practice sessions that we offer to them, so that the employment services team works with them and sort of gets to review their pitch, and they can practice with them and that sort of thing if they're interested in doing that. We have some candidates that take advantage of that, and others say, I'm pretty comfortable. I'm all set with it. It's not an issue. So whatever works. So yeah, we'll have them come in and give you some statistical data.
That'd be great because, I think over the years, probably you've seen that the wide range of job skills and job skill opportunities just grow more and more as technology continues to advance. Being a blind person, I'm grateful that I'm a blind person in this day and age where technology is so readily available. I'm fortunate to be in a state that provides services to support that. And I can't imagine trying to be a productive blind person, the challenges, 50 years ago or 75 years ago. And I think this is a wonderful thing. And I'm sure it's just growing more and more in terms of what the blind community can provide in terms of job skills that meet the technological needs. So,
Yep.
great.
Yes.
Billboards. So you mentioned the billboard campaign. Can you tell me what the message is on the billboards? Just so that if somebody brings it to my attention, I'm aware of what the message is.
Now you're testing my memory, and I just read it yesterday. It's talking about this particular billboard is something that we've done annually, and the Department of Transportation allows us to put a message regarding the white cane. When you see the white cane, what it means, that sort of thing. So people are reminded of that while they're driving. They see the billboard,
Right.
and so that's sort of a reminder that what the white cane is. We're still surprised sometimes where some individuals don't really understand what the white cane is all about, and
I see, encounter it all the time.
Yeah, so we've run this, and they retouched it up this year. They changed it. They're using different, and the wording is a little different on it. But I guess I read it yesterday. I can't recite it to you, but definitely it's in the context of what I just said.
Great. My last question, is there a published agenda for White Cane Day on the 13th somewhere? I haven't come across it.
Lucy, have you seen an agenda? There is.
I can see if it's posted on the website.
Yeah, why don't you check that for us while we're talking here? There is. I mean, there's a whole start time and end time. It's going to be starting in the middle of the morning sometime, and it will. There's an array of speakers going to be presenting there. It's gonna.
Yes, John, on our website, if you go to the White King Day celebration event, there's a whole like overview and outline of the day.
Yeah. What time does it start, Lucy?
It starts at 11.
Okay. And what time does it end?
1.
Okay. And like I said, Perkins will be providing some breakfast items. So if you get there at 10:30 or so, you should be able to get a little bit of a snack, a treat. And yeah, so that's we don't have in other years we have had a walk, people using the canes. We don't have that this year. Logistically, it was a bit of a challenge to do that. Our orientation and mobility department has done a wonderful job at coordinating all this, and it's sort of been their project. The committee has been working on it. I haven't been able to attend many of the committee meetings, but they're definitely doing a good job, and it's up there on the website if you want to visit it, then check it out. But a couple of hours in the middle of the day, it should be a good program.
John, it's Kathy. I'm looking at the invitation and I noticed that there are resource tables available at that event, and I'm
Yes.
wondering if is there still opportunity to sign up for the resource tables?
Why don't you reach out through the MCB info,
Okay,
and it'll get right to the committee that's working on it. And if we have extra space, I'm sure it can be handled. But if we don't have extra space, then I know there was a variety of tables that were already set up there with different vendors. So yeah, drop us a quick email, and Mike will get it to Allie, and she'll look at what we have available.
okay, thank you.
Thank you,
I'm hoping to
John.
be there regardless. I have it on my calendar, but as you mentioned, October gets to be pretty busy, but I am hoping to be there that day. I believe
It's a busy month.
I think I already RSVP'd.
Uh-huh.
Yeah, I will be there, and I missed the whole table thing ourselves because often we've done tables at events in the past, and this one just fell off my radar too, to be honest. But anyway, I'm attending at least. So okay. Well, thank you. Anything else, John, before we go to the public at all?
No, we're good.
Okay. Does anyone from the public have any questions or comments for the commissioner? Debbie, I see your hand is up.
Hi, yeah, thank you. I had two questions. For the commissioner. First of all, you spoke of that strategic planning that's going to go on, and that there was going to be many agencies or different groups that are participating. Is Department of Transportation participating in that?
No, they're not under our secretariat. They're in a different secretariat. So the agencies that are participating are under the Executive Office of Health and Human Services, which, it would be transitional assistance, everyone at 600 Washington Street, the Mass Rehab Commission, the Department of Youth Services, Elder Affairs, Mass Health is involved. I'm missing some, I'm sure, but Commission for the Deaf and the Hard of Hearing, and so there's Department of Transportation is not involved in this one.
Okay, and my second thing was, has there been any progress on appointing a deputy commissioner?
No, not yet. The appointment was just announced recently, so the deputy commissioner is still available, and we will be moving forward on that very, very soon.
Okay, thank you. That's all I had.
Thank you, Debbie. David?
Yes, good morning, all.
Hello,
This is another follow-up on the strategic plan. I think I've read these, versions of these in the past, and correct me if the document you're talking about is a different one than in the past. But the ones I've read in the past, my impression were that they were really more just a description of what MCB does already, and not a whole lot more than that. When I think strategy or strategic planning, I think more in terms of, okay, here's what the organization does. And, based on some needs analysis or something, here's your best shot at analyzing what the organization should be doing. More of this, less of that, depending on what the needs are. And then, making some recommendations in terms of what does that mean in terms of resource implications, particularly with regard to staffing and service delivery. And of course, we all know that there has been a reduction in staffing over the last few years. So my question is, one is, are we talking about the same document that I think I've seen in the past? But more importantly, would this be really more of a strategic reflection? Because I think, particularly where things are right now, I think it is important to go through that whole issue of, here's what our FTEs are currently, and here's what they should be, based on our best estimates of what is needed, and of course, what mix of staffing.
Yeah, so the last document that we did was in 2011, 2012. So you are describing it correctly. So far there has been talk about the mission statement, about the vision, about the priorities. There's been sort of big picture type talk. It's not been actually specific to an agency at this point. The same company is doing and it's being referred to as strategic mapping. So the same company is doing the strategic mapping for all of the agencies. But at the end, there will be a strategic plan. But I think it'll be, again, I don't know. I've never worked with this company before, and it depends on, what the Secretariat has in mind and that sort of thing. I don't know if we're going to get down to that specific, that where you're talking about how many staff and that sort of thing. That's for a different, I guess if it shows up that an agency is understaffed, and that is one of the priorities that we talked about, staffing the agency appropriately. We have the earmarks for staff, and the posting for those 3 positions will be going out probably in the next week or so. We're just waiting for the spending plan to be approved, that we have to file when a budget gets signed, and so that's just about done. That also will allow us to release the earmarks to the organizations that receive specific earmarks, and the RFR is ready to go for the additional funding that was not assigned to a specific agency. So that will be posted also very soon. So things are moving forward. The headcount obviously will increase, and in conversations with a couple of the directors that are going to be receiving the additional staff, that we're given an option of, do you need which position do you need to fill the most? And they they gave their preference, and that's what we're going to post. So we're trying to give the directors and the supervisors, trying to keep them involved in that process so that they select the position they want to fill, so that we can post that actual region's needs. Some regions might need a case manager, others might need a rehab teacher, others might prefer a mobility instructor based on what they have on their caseloads and who's waiting. So this is where I'm allowing the managers and supervisors to make that decision, because they're right at the regional level and they know best what they need and what sort of what sort of relief that position would provide as far as reducing caseloads.
John, this is Brian. I think in reference to David also and his question, 4 months is pretty fast if you're doing a full-blown big strategic plan with multiple agencies and everything else. I think mapping is probably a better word. And I do think it'll identify things you need in reference to, high-level things for each agency, but we're not talking about weaknesses, opportunities, threats, and strengths on each level being drilled down. So
Right.
I don't want people to misunderstand expectations. And I know nothing about this. I've done strategic planning, but my guess is that's what we're going to see in the end result of this.
Yeah. So the strategic mapping is, again, we'll see how it works out, and then we'll take it from there. Whatever data we get, we can certainly utilize. And again, we have conversations with our managers and our staff all the time, and we see where their needs are and where the staff is struggling to keep up with the caseload. So we can certainly identify those. In my meetings with the secretary, I always bring up staffing issues, that we would need additional staffing to ease certain caseload numbers here. And we're talking, but again, I don't know if I mentioned it in this meeting, it's a long process. I can keep talking with her, but we're really talking about fiscal year, next fiscal year.
Right.
It'll be put forward, it'll be maybe identified, and then it has to be pulled in. As far as finances go, we have to have that money in place, and if it's extra state-funded positions, we need the legislature to put that money in, or we need the secretary to authorize that money to be in the budget release. So it's quite a lengthy process. It's not something we can say we need more positions and in 4 weeks here it is.
Right.
As a matter of fact, we're working with the A&F folks, and their main goal is to make sure that we have enough money to pay the current staff, and the current staff, I'll tell you right now, is counting some consultants, is at 138. So they count per head. So whether you're part-time, full-time, or whether you're a consultant, they count per head. So we had, so we're at 138 right now, and but some of those consultants were temporary because we had a lot of staff that were out on different medical leaves. So we brought in a couple of consultants, but that will end soon. So that'll bring that number down a little bit. So we're juggling, we're maneuvering it, and we're just right now we're working with A&F folks, and but we have some vacancies. We filled what we had, but we have some postings.
Yep.
So if anybody knows anybody who's looking for certain jobs, we have some postings available now. And like I said, the earmark postings will be coming out soon. So those that'll be at least another 3 positions available there. So we're definitely filling as much as we can. It does take a process of filling positions. It's quite a process with the state HR system, but we go through it, and we work with it as fast as we can.
Understood. Jane, you have your hand up.
Hello, thank you very much for taking my call. This is Jane Perry from Falmouth on Cape
Hello,
Cod
Jane.
Region. Region 5. Hello there, my friend. Congratulations.
How are
I
you?
have
Thank you.
I have two questions. One is general, the other one is specific to Region 5. The first one is, what is the status to the phone system? And the other one is, couple months ago, you talked about staffing and that you hired somebody recently in the Region 5 for
Yep.
a rehab person.
Amanda.
Was that okay? Was that a SR rehab or a regular rehab? Because the question I have is, we have wonderful rehab people in Region 5, but they're lacking technology issues and experience. So we have to go to Margaret Gaffney, who is very, very overwhelmed. So just want to put that bug in your ear. And those are
Okay.
my two questions. Thank you very much.
All right. Well, Amanda, yeah, Amanda is a rehab teacher, and she'll do the best we can. She's not specifically for technology, so I'm sure she'll be able to help out. But we'll be working with Region 5 very soon, and we'll see what we can do.
Thank you, because we need technology.
All
You
right.
know, we're way down here in the boondocks with transportation, so it's an issue.
You
And the
got
other
it.
thing is, what's going on with the telephone system?
Yes, the telephone system, a lot of the people that were working on it at the technology division left, but it seems like they're rolling the system out. I had a conversation last week with our contact there at the technology services, and he was going to find out when the agency was going to be scheduled to be on the rollout. So they are deploying the system. Several other agencies have already received it. And they'll be getting to us soon. So next month, I will make sure I speak with Billy before, and he'll tell us, hopefully can tell us when our projected new system will be.
Okay, what kind of a
rolled out.
system is it?
But
Is
I'm
it
going to stop there, Jane. I want to let Liz
Oh,
have a chance
okay.
to talk to.
All
Thank
right,
you.
thank you.
All right, thank you.
Hi,
Liz?
thank you. Hi, this is Liz Lesperance from Fitchburg. I just wanted to say congratulations, John, on your promotion.
Thank you, Liz.
And I just have a quick question. I was wondering if there has been any discussion around making public all of the policies that govern the vocational rehabilitation program.
So that's a good question, and I know where that comes from. So MCB's vocational program is run based on the Rehab Act. And all of our directives, when we look at developing policies, come from the Rehabilitation Act. So the policies are available. I don't think there's any, and Nate, you're still on the call, there are no secret policies or anything like that. If a consumer wants a certain policy or reasoning for a decision, they have the right to appeal, and they have the right to ask for that particular policy that was used to arrive at that decision. So there is nothing that hitting, or I mean, I will double check this, but I think there's nothing to be released. But we can certainly take a look at it. Nate, do you have anything else on that?
No, I mean, I'm happy to provide policy to anybody that has a question around it. So if there's something in particular that someone is looking for information on, you can connect them with me, and I can let them review whatever policy they want
I
to
mean,
review.
there's a substantial amount of policies that come from that, like, the college rules and regulations, that those would apply only for college students. So there's a lot of policies so if it's a particular situation, then we certainly can provide that policy to the individual that needs the policy.
Okay, perfect. Thank you so much.
All right.
Any other hands for anybody? Well, then we're closed a few minutes early.
All right.
Thank you, Commissioner. Thank
Thank
you,
you.
Kathy and Blair, and everybody on the calls and MCB staff. Remember, next time we'll be doing it at 12 noon and not at 10 in the morning, 10:30 in the morning. So
Thank you.
have a good day. Take care, everybody. Thank you.
Thank you, everyone.
Thank you, everyone.